Oftentimes, the most important thing is a spouse or someone will say, you quit breathing at night. That's the biggest red flag you can have. Snoring is an indication, but if you quit breathing at night, that's a huge, huge indication. So the first step would be to speak to your physician. Nowadays, your primary care physicians are more familiar with obstructive sleep apnea, but not familiar enough to treat it. So they may then refer you to a sleep physician who then would have you do a sleep study. They look at that, and obstructive sleep apnea is divided into sections, if you will. Since we are all apneic beings, 1 to 5 events per hour is considered normal. 6 to 16 is considered mild. 16 to 30 is considered moderate, and anyone over 30 is considered severe. Nowadays, you don't see physicians as often sending a patient in for a CPAP immediately if you're in the mild range. They'll now say, well, you have another option of an oral appliance. They didn't used to do that, but the oral appliances are so effective, they can do that. When you get up to the moderate range, if a person, ideally you would probably want someone to do a CPAP, but oftentimes they can't because they just, for whatever reason, they're claustrophobic, the spouse doesn't like the sound, there are many reasons, so they may have an appliance. Same thing with a person who has severe apnea. First line of treatment is a CPAP. If they can't tolerate it, it's an oral appliance. So the first thing is to go see your physician. And the other thing too, I think dental offices are becoming a lot more aware of it too, in that as a hygienist, all of our hygienists here are trained, and that they'll look in your mouth and without you saying anything, they might say, gee, anybody ever say you snore? And you'll look up at them and you say, yeah, how do you know that? Anybody ever say you quit breathing? Well, yeah, how do you know that? Because as a dental professional, there are signs in the mouth that we can tell you have obstructive sleep apnea and snoring.